the biggest team sport that you will ever play is working in the operating room, for sure. I make sure that we go through lots of soft skills in my program, but teamwork it's best created through like an understanding of the value of the surge tech training, education, and certification, right? Again, we have come a long way. We are educated people in the operating room.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now, it's time to roll back and start the first case.
On this week's episode of First Case, we are tackling another myth that gets passed on time and time again, pretty much every time a new OR nurse begins orienting in the OR. That myth is related to the role of surgical techs and who they are working under or who they aren't working under. So join us today as we talk with Angel Pickett, Surgical Tech Program Director at Connecticut State Community College, Gateway Campus. And we're going to dive into the role of the surgical tech, understand their training, their education, but also get into the scope of their practice and learn who they work under and who they don't. So don't go anywhere. We'll be right back with Angel Pickett.
Hi, I'm Chris Blevins.
And I'm Melanie Perry.
From the studios of Healthcare HQ, you're listening to First Case.
Joining us now is Angel Pickett, Surgical Tech Program Director at CT State Community College, Gateway Campus in Connecticut. Angel, thank you so much for joining us today.
Thank you for having me.
I'm really excited to have you on the show today to talk about the myth that we're going to be discussing today. And it's actually interesting how we got connected because you and I were both recently interviewed in an article for OR Today. And the article was talking about the role of surgical techs. And in the article, you hit on a very common misconception about surgical techs. And since we are myth busting this season, I knew that we had to have you on the show so that we could talk more in depth about this myth and about this idea of surgical techs and really who they work under, because a lot of people really do believe that OR nurses, a lot of people really do believe that surgical techs work under the OR nurse's license, and that's not necessarily true. So I'm excited to have that conversation with you today. But before I just have the whole conversation myself, why don't you go ahead and just introduce yourself to our audience?
Great, thank you. Again, I'm the program director for the Connecticut State Community College Gateway Surgical Tech Program. And actually, I was a surge tech for 7 years. So I've been in the field for 14 years, 7 years as a surgical tech and 7 years as a program director. I was lucky to find this career when I first sought out this profession. I feel like it was pretty much an unheard of profession. I started out as an accountant when I came out of college. And then I became a stay-at-home mom. In the meantime, my dad had gotten cancer, and I was like, what's the quickest way to get into the healthcare industry? I have to figure this out. And somebody had mentioned surgical technology. I'm like, what's that? What is that? So I looked into it. I was like, that's definitely the field for me. So I practiced for 7 years. I was in cancer surgeries most of the time. Ironically, I was able to be in the specialty of urology, and that was the cancer that my dad had died of. So it was very, very interesting how it all worked out. And when the program director opportunity came up, I absolutely jumped at the chance because I wanted so badly to share my passion for this profession and just be the face of surgical technology in my area and just to help this profession become more respected and heard of. So that's where I come from.
Well, that's really interesting. I was actually going to ask what your favorite specialty was, but it seems like you already answered that question with being in urology and being in cancer surgeries. It's funny how the OR, I guess, offers all of us a little different slice of life for what we find interesting and the different specialties where we can really find our calling and find our niche. I guess it's just one of the other beautiful things about the operating room is because there's so much variety. And as we talk about this myth or this prevailing idea within the operating room and thinking about this season, really wanting to break down some of those ideas that we believe that are hindering our practice, or they're just not right. And we need to change what we believe, change what we think so that we can move forward. It's interesting to think about this idea of surgical techs working under the OR nurse's license. I was actually taught that when I was in orientation at the first hospital I worked in. This was in Texas. I was told that from the beginning, that the surgical techs worked under my license, that I needed to pay attention to everything they were doing because my license was on the line with anything that was happening on the back table. And I'm curious about this idea and how it came about or why we teach that. Can you help us understand where this idea came from?
Yeah, I can try. That's interesting because for a long time, I thought the same thing until I became a program director. And I still think that people still believe that. And it could be the case in different states. But I think possibly years ago, nurses were, performing the scrubbing duties in the operating room. And even today, they're still trained to fill in for surg techs when needed. Although surgical techs do have more of a detailed and specialized skill set, right? Rooted in the technical details of the surgery, including surgeon preference and with sterile technique. Surg techs are now required to earn an associate degree and graduate from an accredited program. And there are states and hospitals that require that surg techs to pass the exam before they even work in the operating room in their state. Surg techs are not licensed, as we all know, and they typically, I should say had, because I'm not so sure it's true anymore, lower compensation than RNs. I could talk for the state of Connecticut, not necessarily the case anymore. We are in high demand. I feel like we are becoming much more well-respected, educated. So there just has been like a tendency, I think, for healthcare professions to view them, at the same level as orderlies or medical assistants. Just not the case anymore. And more so, even public statements that were made years ago in nursing journals, they tried to paint unlicensed, assisted personnel as a threat to patient safety. And AST has rejected the claims and points out that scrubs nowadays, or surg techs nowadays, are credentialed members of the surgical team and were certified by a national association. Furthermore, surg techs must periodically renew their certification through continuing education and retesting, whereas some states don't require license renewals. But I still do want to point out that there were, and maybe still are, some states that have surg techs who work under the supervision of a registered nurse.
Okay, so I have lots of questions as we continue this conversation. But one of them first actually has to do with the surgical tech certification, because one of the interesting things about that certification is national, right? A surg tech who is certified everywhere in the United States. It's not like nursing licenses, right?
That's right. But there are some states who require something a little bit additional, just so that you know. I don't know what states they are, but I do know that some of them require something minor above that as well. Connecticut's not one of them.
Yeah, a little bit of a few extra steps beyond the certification. Okay, but that's interesting because that is one of the differences between nurses and surgical techs. Our license is state specific. Now there is multi-state licensing as well, and so we can move about between states to some degree. But it is typically at the bottom level, it is state specific to where we get our license. And so the surgical tech being certified nationally is a very big difference between us in the operating room, between the nurses and the surgical techs with our degrees or certifications. So the other thing that I really wanted to ask more about is you said that surgical techs actually work under the supervision of the surgeon. Do surgeons know that surgical techs are working underneath their supervision, or do they think that surgical techs are working on their own?
That's a funny question. Well, so I will say personally, as a surgical tech, I have had a surgeon say to me, "You work under my supervision, so you need to help me with this." So as far as I know, they do know. They've had me do stuff that I probably shouldn't have done, but under their supervision. So, and this is a great little paragraph that I had gotten from AST. So it states, generally, CSTs work under the delegatory authority of physicians, specific provisions for which vary slightly from state to state. The underlying principle is that physicians and surgeons may delegate to non-physicians those tasks normally carried out by another physician when performed under the direct supervision and in the physical presence of the physician, and the physician and or employer has made a reasonable determination that the person to whom those tasks are to be delegated has the appropriate skills and knowledge to perform those tasks safely.
Okay.
So
yeah, they have the ability underneath the surgeon to perform the task that the surgeon wants to delegate to them. And I think that's very good that they also included, the hospital policies, and that they have been determined to be skilled in that area so that they can do those tasks, because my next question was actually going to ask about where does hospital policy and hospital maybe rules fit into this as well?
Yeah, absolutely. You have to, here's another statement that I had found that, well, I guess this is kind of a law, but specific requirements vary by state. It's essential for surge techs to be aware and comply with the laws of their respective states. But it's absolutely, hospital policy should always be put in place.
Yeah, for sure. Okay, so it seems like in an effort to clarify or clear up the roles, the responsibilities, and really to understand who they are working under and the scope of their role, it almost feels like it gets a little bit murkier when we talk about, okay, well, it's not underneath the RN license. It's under the supervision of the surgeon. The surgeon can delegate to them as the surgeon sees fit. And as long as it's in compliance with hospital policy, hospital rules, or the facility for that matter, then it is within the scrub tech scope to be able to accomplish those tasks that are delegated to them. Is that kind of like the best way to summarize how that delegation and that role works?
Absolutely. And as long as it's in their scope of practice, right? Because we all know that there are certain things that surgical techs absolutely may not do.
And where is that scope of practice found?
Scope of practice is found on the AST website, is where I usually find it when I need to look something up. Yep.
Yeah. All right. So, and obviously, any of our certified surgical techs listening, and hopefully all of our surgical techs listening, know how to access AST's website and to find all of that information. But I know that every surgical tech practicing in the United States is not certified. We do have many surgical techs who have gone through different routes or been trained at a facility. But AST still provides guidelines for all surgical techs when it comes to what their role is and that scope of practice. Very similar to nurses being able to find the Nurse Practice Act in their state to be able to look up what is within their scope and what is not, because we all have things we can do and we all have things we cannot do. I think it would be helpful to just kind of dive deeper into the role of the surgical tech. What is their job and what are their responsibilities in the operating room?
So in general, surg techs are responsible for assisting the surgeon, maintaining sterile technique with a focus on the technical aspects of the surgery. They're pretty much known as the surgeon's co-pilot or right-hand man. They provide instruments and supplies to the surgeon. They also prevent death and harm related, as far as medication and surgical fires. They handle instruments, implants, cancer specimens. We prevent infection and bleeding. Surg techs are the surgical team member that maintain the sterile surgical field, like I said, to ensure that members of the surgical team adhere to the surgical technique to prevent surgical site infections. So there's a big job involved for surg techs. They are trained for at least 2 years in school, and they also are not just responsible for passing instruments.
I was actually going to bring that up next. I'm glad you said it.
Yes.
But that is not, they are not just instrument passers, are they?
Oh, no, they are not. It is a physically, mentally demanding job. They get there, 6:30 a.m. Before that, they could be standing all day. They have to deal with different personalities and, upset surgeons.
Yeah, and they're right there on the front line of it too. As a circulator, we're kind of buffered because there's somebody else in front of the surgeon that the surgeon can yell at first before they get to us sometimes. And the surgical techs are the ones who a lot of times just get the worst of it because they're right there and they can take a hit sometimes.
Absolutely. But in the same token, I feel like we are, if they have a choice of who they can choose in their room, they're probably going to pick their surgical tech, right? They know their stuff. They like they just like having the same person there, knowing what they do and how they do it and what comes next.
That professionalism and that ability to anticipate and to know what the surgeon needs and to know what's going to be needed and to understand the surgeon's preferences is a huge responsibility, but also a really good asset to our surgical tech coworkers when they have that knowledge and they have that experience. It makes the cases go so much better for everybody. But that is another thing that leads surgeons to really want to request their team to know who their surgical tech's going to be, because they know that tech's going to know all the things and it's going to run more smoothly.
Absolutely. And because everything has become so specialized, and, even under the specialties, there's surgeons who specialize under the specialties. So it gets very, very difficult. Yeah, it's very involved, very complex cases now.
Absolutely. So then we think about it and we think about this idea going back to our myth that we're talking about, that surgical techs work under the RN's license. And like you said, you do need to make sure that's the case in your state, whether it is true or not, depending on where you practice. But in general, sometimes that idea, that hierarchy or that pecking order can lead to some discord in the operating room and can lead to maybe a breakdown in teamwork. So if we want to foster an environment of good communication, productive teamwork, all of those things, what are some suggestions from you for how to improve the working relationship between our surgical techs and our OR nurses?
Yeah, that's got to come early. The first thing that I tell my students when they get into my program, and I can see it in my cohorts, whether or not they're going to be good team players, I say, the biggest team sport that you will ever play is working in the operating room, for sure. I make sure that we go through lots of soft skills in my program, but teamwork it's best created through like an understanding of the value of the surg tech's training, education, and certification, right? Again, we have come a long way. We are educated people in the operating room. We know anatomy. We know preferences. There's a lot going on. We absolutely deserve the respect. And, we bring skills to the OR team. This really needs to be promoted, I feel, by like the healthcare institution, where communication and clear definition of roles can form a cohesive, collaborative environment. Not that it should always be, that's your job, that's not my job. No way. If you need to go take out the trash to get the case, the room turned over quicker, just do it. Do what you have to do. It shouldn't matter, but likewise, surg tech should also be knowledgeable of a nurse's responsibilities and skills and willing to help when it's necessary and allowed, of course, because certain things aren't allowed, even arriving before and staying after the surgery. And yeah, it has to be teamwork. I've seen a lot of really, really good teamwork in the operating room. And it's got to be a collaborative, safe, efficient environment. We all have to work together. I think the hardest thing is that it's a high stress environment, right? And we have lots of personalities, and dare me say this, but it's mostly females, right? So we tend to run a little bit more on emotion than maybe our male counterparts do, if that's fair to say. So I think it could be a little bit more of a stressful environment.
I really do think it is very important that we step away from the hierarchy within our roles in the operating room, saying that you work under my license or I work under this or that or whatever, and take that aspect away, take the hierarchy where everything's rolling downhill away and recognize the education and training and value that everybody brings to the surgical field, to the operating room. Surgical techs' roles are very different than the OR nurse's role. But that doesn't make them less. It doesn't make the OR nurse more. It's just different. But there's value in the training and education that our surgical techs have, and the role that they fill in the operating room is very needed and very important. And I think recognizing that, having these conversations where we take the time to understand the training and education that goes into being a surgical tech and understanding how we can work together, because ultimately, we just want to have a safe surgery and we want to provide a safe surgical experience for our patients, no matter what role we're filling. And I think taking the time to understand each other's roles, the responsibilities, what we have to do, and really taking the time to clear up misconceptions so that we can take away any barriers is something that will help move us forward in the future for a better collaborative experience between our professions. So that's my soapbox and my 2 cents on maybe the whole topic there. But before we bring this conversation to a close, I'd really like to give you the mic one last time and just see what other final thoughts or any other advice you might want to share with our audience before we close today.
Okay. Yeah. I love your final thought just now. And I do want to emphasize that I see a lot of, and I know you feel the same way. I see a lot of great teamwork in the operating room. I feel like, and we are going to continue to be valued because the surgeries are going to continue to be specialized and surgeons are going to be specialized. So gone are the days. Maybe some surge techs out there, who've been around for, many, many years, but gone are the days where you're going to be able to do every single surgery as a surgical tech. You have to specialize. And I do want to say one thing, as far as I discussed the soft skills in my program, we do go through like problem solving and conflict resolution. And I think the most important thing when my students do have some kind of issue in the operating room, the neat thing is they will call me and or come see me and ask me, how to handle things. And I always emphasize the teamwork and how, personalities can get in the way and that, just everybody's in there. Nobody's in there saying, I want to have a bad day. We all want to have good days.
Right.
So it's always, I think it starts early, right? It just starts early. So if you can catch them in the program and work on soft skills, it's a great thing to do.
All right. Well, Angel, thank you so much for joining us today, for helping us understand more fully the training and the role of the surgical tech, but also to help understand and clear the air when it comes to who a surgical tech works under or, where we can delegate and what's going on with the role of the surgical tech. So thank you very much for taking the time to talk with us today. I appreciate it.
Yeah. Thanks for having me. This is great.
That was Angel Pickett, Surgical Tech Program Director at Connecticut State Community College, Gateway Campus. And today we really just got the opportunity to learn more about the surgical tech role, but also to address a common misconception when it comes to our surgical techs in the operating room. And it's something that I was taught when I was starting out in the operating room. And I've heard other people perpetuate this idea that surgical techs work under the OR nurse's license. And in reality, if you go to AST's website, if you look at their scope for surgical techs, and if you really look into their role, they actually are working under the supervision of the surgeon, and the surgeon can delegate tasks to them based on their skill level and the approved things that they can do within their facility. But the idea that surgical techs actually work under the OR nurse's license might have been true in the past, but it is not something that is true today. Although I do encourage you to check out what your own state might say about the role of a surgical tech. But if you want to reference AST's guidelines on this, you can go to AST's website and you can find more information about the role of the surgical tech. But this is just one other conversation in a greater theme of conversations about understanding what we do in the operating room and clearing the air, clearing the misconceptions and the false beliefs that we have so that we can move forward, that we can work together as a team, and that we can really understand our roles and responsibilities and prioritizing patient safety, patient care, and a good surgical experience for all of the patients that come through our operating room. That is going to do it for today's episode. On behalf of Chris, myself, and our whole team, thanks for listening to this week's episode of First Case.
Thank you for listening to this week's episode of First Case. As a reminder, you can help support us by subscribing to First Case on your favorite podcast app or by downloading the smartphone app on iPhone or Android. Simply search for First Case in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@firstcasemedia.com. We look forward to hearing from you.